from the BBC World Service, bringing you extraordinary personal stories from around the globe. Search for Lives Less Ordinary wherever you get your BBC podcasts.
Welcome to The Inquiry. I'm Tanya Beckett. One question, 4 expert witnesses and an answer. Life expectancy in the United States is seeing its most dramatic fall for 100 years. Americans are now expected to die at 76 on average, 2 or 3 years earlier than just a few years ago. This is a sharp reversal of what's been happening for many decades. Since the early 1900s, Americans have, on average, been gradually enjoying longer lives as a result of improvements in lifestyle and medicine. But in the last few years, there's been a dip. We might assume this has much to do with the coronavirus pandemic, and certainly COVID-19 has played a very significant role. But there are other important and worrying factors which affect, in particular, young people, and therefore have a profound impact on the numbers. This week on The Inquiry, we're asking, why is life expectancy falling in America?
Part 1. Inequality.
The coronavirus pandemic that engulfed the globe in 2020 became politicised in many countries, but perhaps none more so than the United States. Reluctance from some Americans to get vaccinated and observe restrictions have meant that over 3 years since the start of COVID, figures show that America lost more people to COVID per capita than other wealthy countries. The total so far is over 1 million. This is undoubtedly the main factor that has led to premature deaths in America over the last few years. In fact, it accounts for 3/4 of the decline. But there are other important things that contribute to the overall picture.
Life expectancy is really one of these fantastic metrics in many ways to reflect that well-being, because it's so tied up in so many other metrics as well. You know, when we look at the causes of why somebody may live longer in life, many of those things end up, being related.
Our first expert witness is Jeremy Ney, an adjunct professor at Presidio Graduate School in San Francisco and author of American Inequality, which is a data project that highlights US inequality and regional divides.
Income is a really strong indicator of how long somebody may live. The type of housing and where they live as well is also a strong indicator. Education can also, be quite powerful, and violent crime as well.
He says life expectancy changes significantly from one community to another.
Depending on where you live, you may live to 67 on average, but if you live in certain other parts of the country, you might live to 87 on average. So a 20-year divide in life expectancy. And this 20-year gap is actually the worst gap that America has seen in the last 40 years. The trends that we are seeing at the moment are some of the most challenging trends that we have seen in nearly a century. These are really historic times when it comes to debates around life expectancy. But really the most interesting thing, for us to understand about this historic time that we're in is the different communities and the specific counties that are really struggling with this. The 20-year gap that we are seeing across regions has not been seen in the last 40 years. So the fact that some Americans will die at 67 on average, you're only a few years into your retirement, is also an injustice, that we haven't seen. But then, other people who are born in other counties, for no fault of their own, might live to 87.
Jeremy says these substantial differences in life expectancy between regions of the United States can be traced back in large part to the availability of medical care. America's Medicaid program was set up 60 years ago to help poorer Americans access health care. Over 20 years ago, under the presidency of Barack Obama, it was extended to include more people. But it's down to each individual state to implement these changes, and 10 American states have opted not to do so.
Medicaid expansion is absolutely one of these ones where we see specific state policies that, have created a challenge for life expectancy. So for states that have expanded Medicaid, it basically saves more than 200 lives per every 100,000 people and decreases the risk of premature death by about 50%. So this is a federal policy that can be adopted by, certain states. And that for those states that haven't, we end up seeing, this impact to life expectancy.
There are other very stark realities thrown up by the statistics. Poorer communities have shorter life expectancies, and Black and Hispanic people, on average, can expect to live fewer years than their white counterparts.
Relationship between race and income, too, sort of still in the same category. Unfortunately, Black Americans tend to be much lower income Americans, especially in the South. And Black Americans end up living 5 years less than their white counterparts, almost regardless of region, too. And so race is highly correlated with income in the U.S. and is one of these driving factors. And much of this, persists even outside of the COVID-19 pandemic, right? That the pandemic did decrease life expectancies, and the U.S. response was particularly weak, especially compared against other countries that had much, faster and stricter responses. But many Americans died too young as a result of that U.S. response.
There are also worse outcomes for Americans who find themselves convicted of crimes.
Inequality really occurs in communities, and so we try and dig down to those levels deeper to understand really what's going on in the ground. So in Florida, for example, some parts of the state have actually very high life expectancies. Many elderly people, going there to retire, exercising well, eating well, spending a lot of time outside. But there's one county that, is really struggling in Florida, which is Union County. It always shows up as this bright red dot in the state, particularly in areas where people do live a bit longer. And Union County, Florida is actually home to the state's largest prison. So many Americans who end up getting incarcerated there end up dying, much younger because of the tragic carceral system that we have in the U.S.
There's another factor that we would expect to affect overall life expectancy, and that, of course, is war. America has been involved in prolonged conflicts in Iraq and Afghanistan in the last 20 years. But the greatest cost to lives in recent decades was the war in Vietnam. 58,000 soldiers were killed over the course of 20 years in Vietnam, and the losses had a profound impact on American society. But that figure is comparable to the number of Americans who die every year at home on American soil from one single cause. Time for our next expert witness.
Part 2. Guns.
Gun violence is the #1 killer of children and teens. It has overtaken cars. And these shootings and these mass shootings will continue to happen until our lawmakers step up and pass gun safety legislation.
How big a problem are gun deaths in the United States when we look at the overall figures?
How high a mountain is Mount Everest? This is a huge problem for us here in the United States, and we've reached some new measures. It is now the leading cause of death for children 1 to 17. It's more than any other cause of death for all those ages is guns.
Dr. Mark Rosenberg helped set up the Centre for Disease Control's National Centre for Injury Prevention and Control, and is a key proponent of research that examines how to reduce gun violence. In 2021, 48,000 Americans died as a result of gunshot wounds, a number that has risen sharply in the last few years. Mark says that the growing number of shootings is a reflection of the fact that the volume of guns in circulation has ballooned in recent decades and now runs into the hundreds of millions.
They may be kids who can get their hands on their parents' gun at home and unintentionally shoot a sibling or a parent or themselves. They may be young men who see no hope and have no future or income and get guns through illegal channels in their community. They may maybe guns at the homes of people who think they have them for self-defense, but by having a gun at their home, put family members at risk for homicide or greater risk for gun suicide. The more guns we have, the more gun injuries and deaths we're going to have.
Another alarming statistic is how Black Americans are disproportionately affected by gun violence.
One of the most striking aspects to me is the ratio of deaths among young men 18-24 who are Black compared with deaths among the same age group who are white. When I was working at the Centers for Disease Control and Prevention here in Atlanta, I was outraged that the ratio of young Black men to young white men who died was 12-1. I thought, what a terrible comment about justice in this country. And I thought that that was something that had to be tackled. And nowadays, that ratio is no longer 12-1. It's 20-1.
Deaths caused by guns have a profound impact on life expectancy because they often affect young people.
When a young person dies, let's say they die at age 20 and their life expectancy may be 65, they lose 45 years of potential life. That's what's lost when a young person is killed with a gun. If someone dies from a heart attack at age 64, that's 1 year of potential life lost. So that the ratio here of 45 years of potential life loss from gun death to 1 year of potential life loss from a heart attack is one way to measure the import and impact of gun deaths.
But there's another crisis that has gripped America in recent years and that has also taken the lives of many, many Americans before their time. Time for our third expert witness.
I had just come out of one of my bare-knuckle boxing matches. I don't know why, but the first thing that came to my brain was, what if I do a drag show?
Remarkable personal stories told by the people that lived them.
I could easily have pulled that trigger, but that was not my brief. I was not an assassin. I was not told to do that. I was not told to murder him.
Lives Less Ordinary from the BBC World Service. Find it wherever you get your BBC podcasts.
Part 3. Opioids.
The CDC shared a truly staggering statistic on drug overdoses. Nearly 108,000 Americans died from overdoses last year. That's the most ever, and it's about 15% more than the record set in 2020.
So I'm Dr. Judith Feinberg, and I am a professor at West Virginia University School of Medicine.
Before her current post in West Virginia, our third expert witness worked as an infectious disease specialist in Chicago, Los Angeles, and Baltimore. During her time in these cities, Judith saw many patients who'd become caught up in the wave of heroin addiction that swept America from the 1980s and led to the spread of HIV/AIDS. She saw multiple cases of heart infections in addicts caused by their use of dirty needles whilst injecting heroin.
So I was at the University of Cincinnati, and in 2005, on 2 different occasions that year, I saw a few too many cases of a heart infection called infective endocarditis. I knew that endocarditis could readily be associated with injecting drugs. So the first time I saw this, I sort of scratched my head because I knew that Cincinnati, metropolitan Cincinnati, was not a place that heroin had really ever penetrated. I was very puzzled by this, but the second time I saw it, I knew that what had happened was that heroin had come to this part of the world and was a problem and would continue to just get worse because that's the nature of opioids.
What Judith had encountered was the tip of a new opioid epidemic that was about to grip America. Only this time around, there were important differences. The explosion of heroin use in the 1980s affected mainly bigger cities. This time, the crisis started amongst manual workers within small towns. and it had sprung up not from recreational use, but the taking of prescription pills. Several years before, doctors had been given the green light to prescribe opioids to treat chronic pain, having been advised there was negligible risk that the patient would become opioid dependent. It turned out that advice was disastrously misguided. The crisis was made worse by the fact that pills started to be handed out to patients, as Judith puts it, willy-nilly.
There's a small town in southern West Virginia, deep in the coal fields, called Kermit. It had 392 residents and one local pharmacy. And the line of cars waiting to get prescriptions filled at this pharmacy would sometimes be blocks long. People all around discovered that this pharmacy was a good source of medication. So this line of cars was not only people who lived in Kermit, West Virginia, but people who lived in surrounding areas and even people who lived out of state. So this town of 392 people, this mom and pop local drugstore, over a period of 4 years received 12 million pills. So no wonder there were lines of cars blocks long. People were coming from all over because this drugstore had the pills and clearly had little compunction about filling prescriptions and asking no questions.
Judith says the epidemic went on to gut whole communities, destroying lives in its wake.
If you look at the statistics for individual states, for example, West Virginia, which has had the highest opioid fatality rate for well over a decade, we are now above 90 fatalities per 100,000 people. That's the rate. That is a spectacular rate, and it's actually almost double the rate of the state just behind us, the state with the second highest overdose fatality rate. So I think it's unquestionable that the opioid epidemic has had an enormous impact on life expectancy in the United States.
By 2022, the number of Americans dying in the course of 1 year from overdoses had tipped over the 100,000 mark, twice the annual number of deaths from shootings. Time for our final expert witness.
Part 4. Cancer and cardio deaths.
Health is actually getting worse over time, particularly for Americans under the age of 65. We're seeing higher mortality rates, lower life expectancy. So the health of Americans, and certainly for particular Americans, is in trouble.
When we look at the drop of life expectancy in America, we are, of course, looking at the major factors taking the lives of young people, simply because this has the most dramatic effect on the figures. I mentioned at the start of the programme the impact of COVID, which has so far taken the lives of around 1 million Americans over the course of 3 years, a higher per capita rate than in other wealthy countries. But there are other diseases for which the numbers are so huge, any deterioration has a big impact on life expectancy. Our final expert witness is Ellen Maurer, Professor of Health Economics at Harvard University.
You want to ask, what is it that people are dying of? What gets overlooked is we're actually seeing sort of a slowdown in improvements in areas like cancer deaths and heart disease, which of course are two really big killers in the United States. If you combine heart disease and cancer deaths, these account for more than twice as many deaths as what we call deaths of despair. So things like drug overdose and alcohol-related deaths and suicides. So this does get overlooked, that things are actually not improving as much as they had been in prior decades.
About 600,000 people die in America every year from cardiovascular disease and cancer. The fact that these numbers are getting worse is contributing to a small but meaningful decline in life expectancy.
One thing people point to when they think of America is the obesity problem. To what extent is that playing into this reduced life expectancy?
It's certainly not helping. I do think we sometimes focus on it at the expense of other things. It is true that the obesity rate is rising everywhere. It's rising for all kinds of groups in the US population. But we don't see, for example, one of the things that I study is differences in mortality across different states in the US. We don't see, for example, that states with rising obesity or higher obesity rates actually have are the states that have higher death rates. So I think it may not be playing into this quite as much as people think, although it certainly is a risk factor for cardiovascular disease and it is a risk factor for cancer.
What Ellen points to echoes what our first expert witness had to say about access to healthcare, and more particularly for people on low incomes.
So there is a lot of evidence to say these programs actually save lives. These programs are not rolled out evenly across the US, for example. So the states that have chosen not to expand Medicaid following the Affordable Care Act also happen to be states that, by and large, also have higher mortality rates.
Even for Americans who have their own insurance, they often need to pay out to get treated in a system called copay. This can act as a disincentive to seek medical help.
They're afraid to go to the emergency department, even if they think they might have a heart attack. They are cutting down on medications when they're facing higher prices for their medications. There's some recent research that shows quite compelling evidence that actually this has deadly effects for people with chronic illnesses who are not taking medications that are effective for chronic conditions.
Why is life expectancy falling in America? The fall is largely due to the COVID pandemic, but there are several other factors. When it comes to deaths from gun violence, there seems to be little hope that things will improve. But it's also worth saying that fatal traffic accidents also appear to be steadily on the rise. The factor, though, that overarches all others is wealth and access to healthcare. A final thought from our first expert witness.
Inequality is often thought of in terms of income, but what I think is so important about life expectancy is it's really not about the bills that you have in your pocket. It's about the breaths that you have on this planet. And so when we, for a variety of reasons, whether it's for gun violence or drug overdoses or suicides or poor health care, when we start taking Americans, before their time is up, before they've been able to, do everything that they want to do on this planet, in my mind, that's, the biggest injustice of them all. Time is our most valuable resource, right? It's the only thing that we can really never get back. And so by stealing time from others, that's where the real pain occurs.
This inquiry was presented by me, Tanya Beckett, produced by Philip Rivell, researched by Bisi Adebayo, edited by Tom Bigwood, and the technical producer was Mitch Goodall.